multi-hazards, all protecting communities.
The opioids crisis is ravaging our communities. How can we all respond in a better, savvier way? Join Guy Felicella, addiction educator, harm reduction advocate, and public speaker, and me, Multi-Hazards podcast host Vin Nelsen, as we discuss how Canada, the United States, and the world can work smarter in dealing with opioids and all the addiction pandemics that we face. Have a listen. So hello, dear listeners. This episode is where I have a great conversation with Guy Felicella. But first, let's give a territorial acknowledgement. We work, study, and live in a region south of the Stalo, aka Fraser River, which overlaps with the unceded traditional and ancestral lands of the Kwantlen, Musqueam, Katzie, Semiahmoo, Tsawwassen, Kikite, and Quiquetlam peoples. These are the names of the awesome First Nations groups who live around me and have been here since time immemorial, around Greater Vancouver on the west coast of Canada. So my guest for today is Guy Felicella, named in the 2020 Vanmag Power 50 and recipient of the 2021 Courage to Come Back Award. Guy is a qualified expert who devotes his time and career to public speaking and advocating to reduce the stigma of harm reduction and educate on drug policy and addiction. Guy Felicella grew up in a middle-class home in Richmond, BC, Canada, but fell into drug addiction at a young age. Guy spent 30 years in the repeated cycle of gangs, addiction, treatment, and jail. He spent nearly 20 years residing in the 2-block radius in the Downtown Eastside of Vancouver, Canada, and using many resources, including harm reduction, to keep himself alive. Today, Guy has escaped the grips of the turmoil that kept him suffering and resides with his wife and 3 young children with multiple years of recovery and sobriety under his belt. Guy is passionate about advocating for the vulnerable people who still suffer in addiction and educating communities on harm reduction to eliminate the stigma that exists around it. Currently, Guy works for Vancouver Coastal Health, the Ministry of Mental Health and Addiction, and the BC Centre on Substance Abuse. In addition, Guy attends various school districts and post-secondary institutions to educate students on addiction. Guy spent nearly his entire life suffering in addiction, and he is now using his experience to change the hearts and minds of people to the idea that recovery is harm reduction and harm reduction is recovery. Gone are the days where it's either harm reduction or recovery. It's both. Guy Felicella's website is guyfelicella.com, and it's spelled Guy, G-U-Y. Felicella is spelled Felicella.com. And now, without further ado, let's get to the interview. So, hi, everybody. This is the Multi-Hazards podcast with addiction educator Guy Felicella here. And so great to have you on the show, Guy.
Hey, Vin. Thanks for having me.
Yes. And did I pronounce your family name correctly?
You sure did.
Okay, good. I had to look on YouTube to see if I was doing it right there before. So I'm just wondering, now we're still in this crazy pandemic. It's like been a year and a half, and we're hoping that it's going to be ending soon. We're just hoping. So I'm just wondering how you and the people around you have been coping during this really hard time during the pandemic.
Yeah, well, we just, basically do whatever we can, obviously, you have your family, friends, and loved ones that you're concerned about. So you follow the health regulations and, do your best to physically distance yourself from people. And so, I've been doing that we've been doing that really good, actually. Obviously, part of my job also working with the health authority, a lot of the population that we were vaccinating with pop-up clinics in the downtown east side of Vancouver. So making sure that, we were protecting not only ourselves, but making sure that we were protecting others. So.
Right. Yeah, I know it's really, really important, and it's kind of challenging times. So now there's so many news stories online, I noticed, about your background, and it's a really wonderful story, what has been going on in your life. And I know you could probably take up 4 hours of, it's just such a wonderful story, but I'm just wondering, in a nutshell, what's your background, just so the audience knows?
Well, yeah, I mean, I started using drugs at a very early age, at 12 years old, and dealt with a lot of trauma as a child, and throughout my lifetime, which led me down a path to drugs, gangs, prison, and eventually found myself homeless in the downtown east side of Vancouver, where I survived decades of being homeless. The first public health emergencies in the 90s, which was the HIV crisis and the overdose crisis, where 1 in 4 were infected with HIV in the downtown east side, and survived 5 osteomyelitis bone infections, 4 in my left leg and 1 in my back, where I had to relearn how to walk again. And I survived the induction of fentanyl in 2012 and 2013, where I overdosed 6 times in a 9-month time frame. And then, the last overdose really took a lot out of me, both mentally and physically. I was a lot slower of a person for a while, and it took me a while to regain focus. But I knew that day that I was either going to die in my addiction, or I was going to die trying to get out. And I left the downtown east side with 1 set of clothes on my life, and went to an outpatient trauma-informed program, and got counseling and trauma therapy, and it changed my life. Met my wife, got married, have 3 beautiful kids. I have a great job and a great life today. And so, that's pretty much the journey in a nutshell.
Right. Now that is amazing. Now, especially in light, I didn't know this, but that you were there at the onset of the opioids crisis, which we're talking about today. And honestly, I didn't know much apart from what I see on the news all the time. And then I went to the library, tried to read couple kids' books on it and watch a documentary on it. But now that I've learned something about it, it's just unbelievable what is going on. And people from all sectors of society are losing family members. And it's just a heartbreaking and ongoing crisis that just seems to get worse. Now, I'm just wondering, Guy, you were there at the onset, do you have an idea, where did this actually come from?
Well, I mean, you really have to look at the underlying issues of the root causes of why drugs become more potent over the years. If you, like anything, the harder the enforcement, the harder the drugs. And what I mean by that is really our drug policies that are in place right now means that prohibiting drugs will just make it get increasingly worse. And so, in 2012, there was fentanyl starting to, saturate the market. But back then you could also still purchase heroin. And so today that's not the case. It's very challenging to get heroin, and fentanyl is 100 times more powerful than heroin. And so what it did for me, I mean, I never overdosed in 20 years, but when fentanyl hit the streets, I overdosed, 6 times in 9 months. So really what it is it's extremely more powerful, and it doesn't last as long in your body. So you have to use it repeatedly. And so it really changed the way I use drugs. I had to use it more often because I kept becoming into withdrawal. And with the potency level the way it is, it's just, kills people. And so like it did with me 6 times, just luckily for me, someone was always there to revive me.
Right. Right. Yeah, it's just unbelievable once we learn about it. Now, I know that news reports, they always say that society, we're doing a bad job with this, right? It seems that everybody who talks about it, we're doing a bad job. But just to start off with, is there anything right that is happening right now? Have we learned something over the years or no?
Yeah, no, for sure. There is, obviously leaning on, we've leaned on harm reduction to actually reduce a lot of the deaths. But then again, I could also say that when are we going to stop relying on harm reduction to reduce the deaths caused by our bad drug policies and change drug policies so that harm reduction doesn't have to, pretty much work so hard, because these drug policies actually limit what, harm reduction services can be available. So you can't offer, a safer drug supply outside of the medical system because of the Controlled Drugs and Substances Act, which is our policy. So it hinders things. The good part about, obviously harm reduction with what's available is, yes, there's a lot of naloxone. Yes, there is OPSs and SCSs in areas so that people can use these substances. But, we've done well at tinkering around the sidelines of it, but we just haven't done well enough to have a direct response to the crisis itself.
Right. So you're saying that one of the keys is the law, which is basically, people wanting this thing to be controlled as if it can just, you can flip a switch and control it, right? So you're talking about the law is the key.
Yeah, the real root cause of drug toxicity deaths is our drug policies, because it doesn't allow us to implement strategies to meet substance users where they're at. So unfortunately, what happens is that you can meet the law where it's at, but that doesn't address the root causes, which is death to some people. And obviously, I think, because of those laws and policies that are in place, we as a society associate with drugs as being bad, and that's what people need to stop doing. It's not so much that yes, drugs can be deadly, just like alcohol or tobacco. Tobacco and alcohol kill more people than illicit drugs. So when you actually look at it, and these are regulated drugs, what we have right now is an unregulated illicit drug supply that is killing people. If alcohol were actually killing people every 6 bottles, or 6 people died every day immediately from drinking alcohol, like they do the illicit drug supply, I could guarantee you the government would move in and change that immediately, right? And I'm sure society would expect the same thing. Unfortunately, we don't do the same for the illicit drug supply.
Right. Now, when people argue with you, I don't know if they ever dare do this, right? But do they ever use that slippery slope argument saying, well, if you open up things, it's just going to we're all going to be addicted, right? It's going to take over the whole country. It's almost like a glorified conspiracy theory.
Well, sure, I hear it from time to time, but it's not listen, if I opened up a heroin facility in your community and you're not a heroin user, you're not going to go there and use it. It's the same thing as saying that if you put a liquor store in somebody's area and they don't drink, that they're going to immediately go, oh, there's a liquor store there, let's start drinking. That's just not reality. And it's the same concept with the supervised consumption thing. I just don't see anybody saying, let's go, that's never used drugs or injected drugs, wanting to go use one. So, those are the things that, I think what happens is because they're illegal and illicit. And if you think about the country of Canada, which is 37.5 million people, 6 million people will develop a substance use disorder at some point in their lifetime. So that's alarming. That's almost 20% of the population. And when you think about that, it just shows how many people actually use substances in this country. There's lots.
Right. And one reason I wanted to get you in this podcast is I saw this, there was this wildfire or flood, I can't remember, evacuation of a First Nation in Saskatchewan. and they ended up getting relocated to, I think it was Regina. And it said that they ended up having an addiction crisis there, but it was a result of the trauma that everybody had from being in that disaster situation and then getting relocated, and they're far from home and they're relying on, say, the government. They're in a strange place. So it's all that trauma that gets in there. So I think these things really compound. It's not just an isolated thing that's happening. It's just everything's kind of connected to it. So it gets really complicated, right?
Yeah, and I tell you right now, coming out of COVID, we're going to have one of the biggest mental health crises that this country has ever seen. There's far more people using drugs to numb the pain. There's a lot of people, I mean, including myself. I never used drugs socially. I used drugs to get wasted. There was a difference. And really why I used drugs was to numb my pain. And trauma, often childhood trauma, is the main driver of why people struggle with an addiction. And yet we don't have trauma therapy or counseling covered under MSP. So that means people have to pay for their trauma therapy. And that's about $150 an hour. So what we have is basically saying that if we're serious about treating people with an addiction, then all I'm saying is then we need to be serious about covering trauma therapy so that people can access that, because that was really the thing that changed my life.
Right. So that actually helped you to basically solve your problem. You were looking to substances before. Now, I saw something that said that the pandemic, it made this much, much worse. And it said, what was it? Public Health Agency Canada said 17 Canadians per day died in 2020. And I don't know what the rate is this year, but it's probably just as bad. Now, and I heard a podcast basically saying it's because that the supply chain getting in the opioids to, say, Vancouver area, it's been disrupted, and there's all these disruptions happening at different points. And it just means that people are, I don't know, like the situation there, but you've been seeing it on the ground the last, say, year and a half, right? So how has the pandemic affected things?
Well, I think the pandemic has in many ways impacted the crisis. However, if you look further before that, still, it was the COVID didn't come on until 2019. So 2016, 2017, 2018 were all horrendous years for people who use drugs. There was many overdoses before COVID. And yes, I'm sure the border does have a big part of it, but what do you think? Do you think is that us saying, well, wait till the borders open and we'll rely on organized crime to get their stuff together to put out safer drugs? That's not going to happen. If you're going to rely on them to do anything, you're going to lose. This government and any government needs to actually regulate the drug supply so that you can actually compete with them by giving drugs that people are seeking instead of low-grade drugs that people don't want, such as methadone or Suboxone. And not to say that those don't help some people. What happens is the only way to access those safer drugs is that if you have a substance use disorder. And, there's a lot of people who use drugs intermittently who do not have a substance use disorder, but they're at severe risk of overdose as well. Right. And they can't access those safer drugs either.
Right. And I heard that opioids, people got into it it could have been an auto accident. It could have been an athletic injury. It could have been many different things that kind of led them into getting an opioids addiction. And then things just get worse. Have you seen people like that?
Yeah. I mean, I've been around long enough and to see lots of things in my life. And yeah, I've seen people use drugs for pleasure that, just unfortunately became addicted. No one chooses to become addicted to drugs, and nobody chooses to die of an overdose. Our society has to get their head around is that people use drugs, and guess what? Just like people drink alcohol, not everybody who drinks alcohol has a problem with it. It's the same thing with substances. We just need to actually regulate those substances so that people could use them safer. Sure, drugs, people are going to die from using drugs, but they shouldn't be dying or dropping dead on one hit. That just shouldn't happen.
Right. I remember, what was it, 2 years ago, and I met some people, they thought the end of the world was happening because Canada was legalizing marijuana. And I thought, well, you think that's the end of the world? But here we are a couple of years later, and it looks like we're still here. So, and the city of Vancouver is actually advocating all a different range of drugs to be legalized in Vancouver. Has that got off the table yet?
You mean the decriminalization of substances in the city of Vancouver?
Yes.
Yeah, that was an application that was put into the federal government. So that's just in its process stage. So I guess we find out if it gets approved, and if it does, that'd be, a step in the right direction for sure.
Right. Okay. Now, you're working for this website sometimes. It's called Vancouver's Awesome. It's a news website, and it's really, really a great website, I think. And you started writing columns for that. And I think that started around January, something like that. You started?
It's been great. Get to write stuff on, drug policy. So it's been a lot of fun. I write one article each month, and usually I think my next article will be due next week. So, yeah.
Okay, that's great. And I read the one, I think it was from last January. You were talking about an empathy gap. And that really hit me because, like, I've been teaching English to immigrants, right? And trying to explain to them about Canada, and many people, I won't say everybody, but many people coming here, they have stars in their eyes. They're like, wow, this is the greatest country in the world. There's no racism. There's no problems. And, sure better than my country where we had war all the time. But I keep telling people, I just said, no, I'm not teaching you to hate on Canada, but you got to remember, we have a lot of things wrong with us. And I think you hit the key when you talked about empathy gap, because, and I don't know why it's here. Maybe it's just because we think about money too much or some reason, but it just seems that we don't care. And it comes out in the opioids crisis. And you said that, I'm just reading your article here. It said the opioids crisis has become a sign of the empathy gap that's contributing to the social conditions that help fuel the overdose crisis. So you said stigma, discrimination, isolation, and despair. So I'm just wondering if you could just unpack this sentence for us.
Yeah, well, what happens in society is that, again, our laws and policies, what they do is they create stigma and discrimination in our own biases and judgment towards people who use drugs. Usually we associate them as being criminals or, to deserve to be punished for using drugs. And yet we lack the empathy and understanding to look outside of our own challenges and problems. So we point fingers and judge people for how they live their lives. And really what that's done is it's just driven people further into isolation. It shows, one of the things even in my time of using drugs is that it's not that I didn't want to leave the downtown east side of Vancouver. It was just, I was so fearful of how everybody viewed me as a person in other communities. And so it makes it extremely challenging for people to move forward with their lives.
Right. I remember a few years ago, I was like I went to downtown Vancouver on SkyTrain just for a work meeting, but I decided to go a couple hours early, beat the traffic. And then I met a fellow who was on the street, and I believe he had been addicted. And, I was just kind of wandering around saying hi to people, whatever, randomly on the street. And he said, hey, you're the first person who's said hi to me in a long time. And I'm just like, what? And, it's that area down in the downtown east side. And just for our international listeners, it's a really bizarre area because you've got the wealthiest of the wealthy working down there, and you've got all these really cool hip shops. And then one street over, you have people who are really suffering. with addictions, and it's called the Downtown Eastside. And yeah, it just, that neighborhood just boggles my mind when I pass it. It's just like, what a contrast. So you're there quite a bit these days, or you're with the Vancouver Coastal Health or with another agency?
Yeah, no, we've been doing, we did a lot of vaccine rollouts in the community, making sure, we knew that there were COVID clusters in that area. And so we wanted to make sure that we did our best to protect that specific community because of all the underlying health issues with people who live in poverty and who are homeless. High rate of getting COVID could mean a death sentence. And also dealing with everything else that's going on in people's lives, sadly, the toxic drug supply and poverty and homelessness. Really, for us, we basically were, there and targeting responses to make sure that we could get people vaccinated. And it turned out to be a really successful encounter for that community. And so it's probably one of my funnest, just to be in that community and help them. And I worked with an amazing team of nurses from Vancouver Coastal Health. And I mean, these people put in a lot of effort to make sure that jabs were getting into people's arms. So high props to everybody on that team for sure.
Right. That's great. So now you were talking about harm reduction, and I just want to step back and try to understand kind of the idea behind it. So it's basically giving somebody something that is less harmful than what you're usually using. Is that right?
Well, I mean, it's part of it, Vin, but really harm reduction is a response to knowing that people use drugs, and there is, you're doing what you can to reduce the harms, the health conditions, the infections, HIV, osteomyelitis. Really, harm reduction is a practice and a principle and a concept that meets substance users where they're at, knowing that they're using substances, and so you want to reduce the harms caused by those substances. It's really one that it just meets people where they're at and wants to help them any way possible to for the expectation of that person's life.
Right. And in the Downtown Eastside, I heard there was a group, and for many years, what they did, at the onset of the fentanyl and the opioids crisis, is they opened up the harm reduction site. And I think for a few years, it was actually illegal, but they just kept going anyways. And the whole idea is to have a safe place with safe supply. And there were actually nurses and other people on board. And it was just a very safe space for people to come from all over, instead of just kind of going off into some place by yourself and doing it. It was there and you're supervised. And they also had sorry, I'm just getting a brain thing right now where I forgot the stuff that they shoot into people if they're having an overdose right now. Naloxone, isn't that right?
Yeah, there's naloxone's a big part of the antidote really of the overdose crisis, and especially in the Downtown Eastside, there's a lot of it in that community.
Okay. So yeah, it's so basically harm reduction is having a safe supply, having maybe professional people around you. It's sort of the opposite of lockdowns and the pandemic, where people are isolated, they're in rooms by themselves. Because I heard that that's one reason why the pandemic kind of made things worse, because people were being isolated from each other instead of having somebody there beside them. So now you were talking about stigma and discrimination in your article there, and you talked about racism, poverty, homelessness, and criminalization contribute to stigma and discrimination. Now, it looks like those are some of the things that actually can bring trauma too, right? People who've had racism in their life or extreme poverty, just being homeless, that can cause trauma. On the other hand, then people feel stigmatized. And then it's like you were saying that it's just easy for the world to dismiss you as a person right there. So when you say the word dehumanizing, because it's kind of like treating somebody like they're not even there, they're not even human, they don't even count, right? So I'm just wondering, what were you thinking when you wrote that part in your article?
Well, if you look, dismantle really prohibition and the war on drugs, and you'll look and you'll see that it's rooted in nothing to do with health or anything else. It's rooted in racism. And you can only look as back into the 1800s with the Opium Act, which was basically implemented against Chinese immigrants who were smoking opium, and white people in the province of British Columbia were fearful of losing their jobs. So they devised a plan to get them back, and they outlawed opium, smokable opium, but they left, that was primarily used by Chinese people, and then left the tonics of opium for legal so white people could drink them. So, and if you also look even closer at the Canada's prohibition of alcohol, it was actually aimed at First Nations people in our country, which the Indian Act and prohibition. So, our policies is really rooted in racism. And so that's where racism exists today. If you're Indigenous or a person of color in the country of Canada and you're a drug user on top of it, man, that's like having a death sentence. And, these laws and policies that are rooted in racism are still in place today. And even if people don't know that, there's that tone of how we view people who use drugs and dehumanize them because of it. It's really based on those laws and policies.
Right. Now you say people, the public, their anger is misdirected. And this anger shouldn't be targeting drug users, but the people with the power to change the situation. Now, that is a very powerful sentence, which you mentioned there. Targeting the people with power to change the situation, because that's exactly it. There's some people who do have the ability to change it, but they're not changing it. So I'm wondering what you think about that.
Yeah, that's, society does have a right to be angry, and they do, but just not at the people who are struggling and using drugs. Direct that at the policymakers in order for them to change those policies. We change those policies, we're going to save a lot of lives. Not only that, but we're also going to address the systemic barriers in our system that allow people to actually be open about their drug use as well. It's really the policymakers that, have made really these drugs become as deadly as they've become. And yet, like I said in the beginning, poverty and homelessness those are forms of trauma, and those trauma, drugs are a great distraction from that. And so oftentimes we always talk about how bad drugs are or how bad drugs are for you. I mean, we really got to start talking about why drugs are good and what they do bring to people's lives. Because unfortunately, there's many people who are using alone and not talking about it. And I'm not talking about people that are homeless. 85% of the people who die of a drug overdose in 2021, 56% have died in a private residence. So that's a house or an apartment like yours or mine. These are people with, careers who work jobs, etc. And, they're not comfortable talking about it publicly at all because of how our barriered system is in place. If you told somebody you use drugs and you'd lose your job, you could lose your kids, you could lose your life. We just don't make it easy on people to reach out for support. So until we start changing those things in our society, we're gonna, sadly see people succumb to overdose.
Right. Now, I'm really curious, is there any country in the world or any city, maybe in North America or anywhere else, where they're getting it right, where you think this is a good role model?
Yeah, I think, in the context of safer drugs, I think Switzerland and the Netherlands have done a really good job. They do have, a heroin program in Switzerland that, meets about 1,800 people there. And so people come in every day and they get their heroin for a few days, and they come back every couple of days to pick up their heroin and go. And in Canada, we have one heroin clinic that's been running since 1999, but it only, there's only about 130 people in Canada that are on diacetylmorphine, which is heroin. And in a country of 37.5 million, where there's a lot more people who could benefit from that program, but it's very political in making it move forward or changing. So,
Right. Now, I was looking at your Twitter the other day, and there was this situation where there was this father, and he was concerned. He wanted to get his daughter off of drugs. And then there was an advisor suggesting to use tough love. And I guess that would be the abstinence method, right? And you have been arguing that it doesn't really work most of the time. It backfires. So I'm just wondering about that.
Yeah, well, tough love really is something that doesn't work. It's really love with conditions. You're going to cut somebody off or not see them, or to force them to stop using substances. And you have to look at the flip side of that, where I always tell parents that are involved in using tough love, and sometimes they get this from an intervention, and I tell them, is using tough love bringing your daughter or your son back? And in this case, it made it worse. And I said, now you really have to understand that regardless of you doing tough love, if your daughter or son dies, are you going to be okay with that? Or are you going to look back on it and wish that you were more supportive? And I've said that to parents, and they've just broken down and started crying. And a lot of the times they blame themselves as well. And I just say, listen, your son or your daughter is struggling, and they really need you to be there to support them. You can have boundaries and healthy boundaries all you want, but the tough love approach can really drive somebody further into isolation. And even in my own life, at 14 years old, my mom went into court, and she made me a ward of the court, which meant that the province would now dictate where I was going to live. But what that really said to me at 14 years old is that we don't want you. And that broke me at 14. I mean, I was just it was just very hard for me to take and understand. And so that tough love really drove me off the rails.
Right. Now, people like you and so many others who've used drugs, and also the people who are health professionals and who've been in this field for many, many years, you've seen what works and what doesn't work. And that's kind of what I call reality 101. But when people are talking about tough love and all these other things, just abstaining, let's just cut it off, just grit your teeth. It's like they don't really know. It's kind of like a knee-jerk reaction, don't you think? They don't really like they haven't researched or studied or anything. They're just thinking this has got to work, right? So where you're coming from is you see what actually works, what actually gets results at the end. So if somebody has a child who is getting on drugs, what you're saying is focus on what really works, not on what you think works, right?
Yeah, I mean, for sure. And I think a lot of the times too, you really have to just be okay that people are going to use drugs. And I'm okay with that. People don't need to drop dead from using those drugs, though. That to me is unacceptable.
Right.
And if somebody is struggling with a substance use disorder or an addiction, going into treatment for 90 days isn't going to stop you from using drugs for the rest of your life. I mean, 90 days doesn't change much. Sure, it changes a little bit, but unfortunately, we need to really have the other supports in place, such as housing, trauma therapy, counseling, employment, all these other things that factor into building a person's self-esteem and confidence of moving forward in their life. We just hear the word treatment and say, yeah, that's it. Well, it's not like going in and doing physical treatment on your leg, and then after 3 months, the broken leg is healed and you can start running again. It's big difference when it comes to the cycle of addiction. This is just, one day at a time, every single day for the rest of your life. I have to continue to put work in every day in this thing. And, I understand that. But really the root causes of why I used drugs in the first place was my undiagnosed ADHD and dyslexia, and also trauma. And so when you get diagnosed, you have more knowledge, more awareness. I'd always carried this feeling inside that I was stupid because I couldn't learn like everybody else. And once I understood how I learned things, it really gave me the ability to start to be like, wow, you mean I'm not stupid? And I remember the specialist saying, no, you're actually very smart, because you've had to do this without support for the last, 25 years.
Right. Well, yeah, I was, I think I saw it in a video. You were saying something like this. And I said to myself, you seem like one of the top functioning, smart people I've ever met, right? Like, how could anybody say that when you're a kid? But again, they're not doing reality 101. They're just kind of doing whatever a knee-jerk reaction would do. And they're just, yeah, it's unfortunate. So now, Guy, there are times when people were walking along the street or walking by a store, and there's somebody who may be a drug user, maybe not. And we're sitting there, and it's kind of like we feel embarrassed sometimes. We're like, what should we do? Right. And you get that a lot in the city of Vancouver and other communities around in Metro Vancouver here. So I'm just wondering, I know for me, it's kind of an embarrassing question, but it's like, it's something we wrestle with, right? Because we're not a savior to people. We can't, go and save somebody. But on the other hand, it feels really snobby and just kind of dehumanizing to just walk past people and go to the dollar store, come out, and we don't acknowledge the other person's humanity. So
yeah, sadly, yeah. Well, when you see people, I think a lot of people just see so much that's portrayed through the media of how people are, and they're fearful because of that. It's just, what it is. It's just people. I walk into the Downtown Eastside community. I can't even walk a half block. It takes me about an hour to walk a half block because I'm sitting there talking to everybody. And, I remember even in my own time down there, when somebody stopped by and said hi or handed me a sandwich or a coffee, or a cigarette, or bought me a breakfast, I mean, it meant a lot. Somebody saw me as a human being. And those are the types of things that really impacted my life, that, as bad as it was, I'm glad there was some good people. And I can remember, one of the most impactful times in my life in the Downtown East Side was Christmas Day. I was sleeping in a doorway, and it was cold. And, I had a bunch of blankets over top of me, and I never met this person before in my life. And she kneeled down and she was shaking my shoulder and saying, "Hey, are you okay?" And I looked at her and I was like, "Yeah." And she said, "Would you like a coffee?" And she already had it in her hand. And I said, "Yeah." And I leaned up and sat up, and she handed me this coffee. And then she went into her purse and she pulled out $50 and she kneeled down and she gave me a hug and she said, "Merry Christmas. God bless you." And she just walked away, and I never in my life have forgotten her. And every Christmas I go back down to pay that forward. It's just a random person showing random kindness that really meant a lot to me. And boy, oh boy, did that ever. It was about 4 months later that I got out of the Downtown Eastside. So.
Wow. Yeah, it's an amazing, we think that these little, few minute events can't really do much in a person's life, but they can make an impact. So, Guy, I'm just wondering, like, what are your dreams? Like, it seems like in recent years, you've just had such a wonderful change in your life, but there's so many years to come, and I'm wondering, what are your dreams?
Well, I mean, I'd make the world a better place for my kids and other kids. And a lot of it is to really give them the awareness of to do better and to be better as people, and try to do the best we can to help each other. And raising my 3 kids is my biggest portfolio that I have. And just being a good person and trying to make a difference in society and trying to pay it forward when I can. And, really just try to help people. I mean, I've seen a lot in this world. I've seen a lot of evil and I've seen a lot of good. And for me, it's just easier to do good than it is to do bad or do wrong. And so, I'll just continue to do that and see where it goes.
Right. That's awesome. Now I'm wondering, do you have a last message for the audience?
Yeah, for sure. I mean, I would encourage everybody to not focus on the people who are using drugs or discriminate against them or stigmatize against them. I would encourage you to push our governments to actually changing the drug policies that have created this whole environment, and allow people a place where they can heal on their journey. One of those things is us as human beings is directing our anger at the people who are in power that aren't, continually doing anything to actually address it. And so I would hope that your audience or anybody would understand that there's many reasons why people use drugs, and but trauma and poverty is a motivating driver of why people use drugs. And if we change those circumstances in people's lives, then we'll have a better chance at improving the quality of people's lives, and not only their lives, but all lives, including yourself.
Right,
So
exactly.
push the government.
Mm-hmm. Right. Well, that is very powerful. I thank you so much for being on the podcast today, Guy, and I hope you have a wonderful weekend. Thank you so much.
Thanks for having me, Vin. It was a pleasure.
Okay, take care.
Take care, pal.
And that's it. Wow, I came away with some powerful insights from this conversation. Now, I just want to mention one thing to listeners. When we listen to a podcast or we read an article or hear some speech or read a book, those things that we learn, they're actually not the end of it all. I encourage all of you, when you hear the things, for example, that Guy Felicella said, that you would take those and do more research. Go out and learn more, because this is not just the end of the journey, it's the beginning. And for example, with the opioids crisis, there's just so many more things that we can learn about this and harm reduction and how to deal with people who are addicted, whether it's ourselves or people around us or people that we meet. Now, I want to give a big shout out to my awesome guest, Guy Felicella, for joining me here today at the Multi-Hazards podcast. So, an important disclaimer here. First, this podcast is meant to be educational, and we don't try to offer legal, medical, or other specific professional or expert advice unless otherwise noted. And second, the opinions expressed here do not necessarily reflect those of the organizations that either my guests or myself are working with. I hope the grammar's okay there. So, here as I conclude this episode, thanks to all of you, my precious listeners, for being with us today. Stay safe out there and stay tuned for more episodes. This is Vin Nelsen wishing you the best on your journey of surviving and thriving with all that life throws at you. Cheers to you all. Peace out.